Within days of Russia's invasion of Ukraine, anesthesiologist Dmytro Prysezhnyuk quit his job in one of Kyiv's main hospitals and volunteered to be a combat medic. He says he sees many soldiers suffering from massive blood loss.
By the time the patient gets to us, they may have lost almost 50% of their blood.
Blood transfusions increase the soldiers' chance of survival, says Prysezhnyuk. These are normally done at stabilization points, places where the wounded are taken from the front lines before they get sent to a hospital. But transfusions require specific medical equipment.
With the help of this kit, we can prepare blood for transfusion. We have to warm the blood up before it will flow into the body.
The blood-warming device that Prysezhnyuk uses was paid for by donations from a Canadian doctor named Tracy Parnell. Parnell first came to Ukraine in the spring of 2022 to train local combat medics in emergency medicine. There she saw firsthand the severe wounds of Ukrainian fighters coming from the front lines. Once she returned to Canada, she began collecting donations to meet the needs of Ukraine's armed forces.
So, reached out to various friends and people and have had, some reasonable success at raising funds and using that to purchase equipment and then bringing it, as far forward as possible and often, bringing training as well. There's no point just bringing some fancy device if someone doesn't know it, and spending time knowing and understanding what the circumstances are that they're working in so that I can better help with equipment acquisition and training.
Because of the complexity, frontline medical personnel were not allowed to perform whole blood transfusions in the field until 2022. The order was expanded in September 2023 to allow trained combat medics to perform blood transfusions at the pre-hospital stage.
That was the turning point when we, as civil servants, got the official permission to contact combat medics in order to fulfill their need in liquids for blood transfusion at the pre-hospital stage.
Blood transfusion, however, is only one step in the complex process of saving the soldiers' lives, says Andriy, a tactical medic with 8 years of experience. For security reasons, we are not using his last name.
There's also an issue of providing fighters with quality devices, like tourniquets, which help prevent blood loss before the wounded get taken to a stabilization point.
Dr. Parnell says she will continue to provide equipment to the fighters in Ukraine.
They're fighting for freedom for all of us, at least that's my belief. And I think at minimum, we owe them the equipment.
Parnell says she's planning to head back to the region with more equipment in the spring. Kosstutschenko for VOANews, Donetsk region, Ukraine.